I call it disarming the patient. You have to disarm the patient while they're in the chair, because they're not disarmed. Anything you tell them, they're not going to accept. They have they're so stressed, they're so anxious. So this disarming the patient even before they come in is so helpful to getting them to say yes to treatment.
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host. Welcome to another episode of Growth in Dentistry. I am Katie Polson, and we are continuing our conversation on getting your patients to say yes to treatment. And before we get started, I wanted to just invite you again to join our Facebook Dental Intelligence community. Come join like-minded data nerds. We have a lot of fun talking about numbers. And even if you're not a data nerd, you can come and talk about dentistry because both of those are equally nerdy. You can also, if you wouldn't mind going and rating and review our podcasts, we read every one of them and we appreciate it so much. So with that being said, and that out of the way, I had a chance to sit in, unfortunately, only part of, I didn't want to leave, but I had to, of Dr. Tau's lecture on case acceptance in Salt Lake City, Utah, at the Utah Dental Association conference. What was that, 2 weeks ago? And as he was talking about expectations, I was like, yeah, he needs to come on the podcast. So I'm so grateful that Dr. Len Tau has been generous with his time to join us. So welcome to the podcast. Thank you so much for joining us.
Thanks for inviting me on.
Yeah. And next to me in that really deep, sultry voice you're going to hear is Steve Jensen.
Hello. I don't know why you called deep and sultry, but yeah.
Because it's
great
deep.
to be here this morning.
Sometimes it like reverberates off the walls. It's so deep. And so anyway, Dr. Tau, give us a bit of an introduction. Obviously you're in dentistry, but how'd you find it?
You can decide that your own after I give you my bio, but I'm a dentist, a general dentist. I practice in Philadelphia, Pennsylvania for the past 15 years of my own practice, the Pennsylvania Center for Dental Excellence. I am involved in a lot of different things. People may know me because I run the dental division for Bird Eye. I have my own podcast called Raving Patients. My brand is called Raving Patients. So I have a Facebook group under the same name, but I help dentists with their online reviews. In October 2020, I moved from Philadelphia to Florida and now reside in sunny Florida. And actually was for the past year plus, I've been commuting to my dental office on a weekly or biweekly basis. And then in October of 2021, so just about 6 months ago, not even, I sold my office to my associate, and now I am an associate in my own practice. So I'm still clinically relevant for another 8 months to a year plus. And then I will sail off into the sunset and do everything else I focus my attention on. But I am a dentist and I help dentists make more money and get more reviews and get better case acceptance. That's kind of a nutshell of what I do.
Yeah. And I would love to, on a future podcast, I would love to have you on just to talk about the transition that you're going through, because I know that that's probably a very interesting topic for a lot of dentists out there that are looking at this, they're in this stage of their growth where they want to sell and become an associate and all of that. And I'm sure that your story would be very, very, very helpful.
It's funny. I wanted to have a podcast episode, but I can't interview myself. So it's called Tales from the Other Side. So because being an associate in my own practice is very different than being the owner in my own practice.
Right.
So I've learned a lot over the past, it's been just over 6 months.
Yeah.
So it's been good though.
Yeah. Giving up your baby is it's not an easy thing to do.
Honestly, it's easier than I thought it would be. I thought it was gonna be a very difficult transition, but it's easier than I thought it would be.
That's great. Yeah. Well,
zero stress, zero.
I'm writing it down. We're going to have you on to talk about that.
And before we jump in, Len's humble, so he's not going to say this, but Len's also an author. Len, why don't you tell about your new book?
So I wrote a book. Well, I have 2 books. One's called Raving Patients, which is like a definitive guide to online reputation. And then it came out a few weeks ago, 100 plus tips for getting 100 5-star reviews in 100 days. There's 125 tips in there on different ways to get reviews. Using automated, obviously, services to just manually doing things, QR codes, talking to the team properly, getting your team involved. So there's a lot of information for people who are looking to find other ways to generate reviews from their patients. It's an important way to learn things that you may not have learned otherwise. And I kind of collected my tips and tricks over the past 15 years I've been doing it, and came up with this tip book. And it's fun. It's available on Amazon or Kindle. So I think it's a very important read for every dental practice owner.
Yeah, really great. So I love your approach that you made to case acceptance, that it starts before a patient even walks in the door. Like they've already made up their mind kind of if they're going to accept treatment or not from you. And so that's really what I wanted to hone in on this next 20 minutes that we have together. So how have you seen setting expectations prior to an appointment impact case acceptance? Take us down that road.
So, I always, when I give my seminars, I always kind of start off by saying I do things differently, and not every practice owner is going to want to do things the way I did it. And just to kind of lay the groundwork, I am the one who presents the finances and the treatment when I'm the dentist there. So I took it over about a year after I bought the practice in 2007. I took over that aspect. I never gave it up because I'm really good talking about money, and I know the dentistry. So I just decided I was going to take that on. And I am very comfortable talking to patients. I answer my own phone. I am very comfortable discussing money. So it just was a good fit. So I've made the decision to actively engage with patients when they make an appointment. So either I pick up the phone when they're calling, or I call them back after they've already made the appointment. I introduce myself. I want to set expectations. I want to kind of just, get them comfortable before they even come into the office, because as we know, coming to a dental office for most people is not a comfortable experience. They don't know anybody. They've had a bad experience prior. And I want to get them to relax even before they come in, because if they're not relaxed, they're not going to accept any treatment that I present to them. So that's a big reason why I would say, and if they're coming into hygiene, I don't call them, but if they're making a consultation with me, whether they're in pain and they know they have a problem, they're coming in for a second opinion, they're coming in for just a new patient visit, and they're in my schedule, I reach out to those patients and I introduce myself and I get the conversation started. And most people are so impressed that I've taken time out of my busy schedule to call a person who hasn't even become a patient technically yet, because remember, they're not a patient until they come in the office. So I'm finding time in my schedule to do that, which makes me very different than most people, and it makes that conversation with the patient just flow a lot easier. So that's the first thing I do. It's very different.
Can I ask a question before you move on?
Sure.
Was that your personality, or did you learn that over time? Like that's very different from.
So for the people that know me, I am uber responsive almost to a T. Like I always tell people that if they send me a message and I'm not responding within an hour, I didn't get it. I respond to people almost immediately because I'm always connected. Other than when I'm sleeping or giving a seminar or drilling, I'm always connected to a phone or a computer just because of what I do. So I just took what I do in my personal life and I put it into my professional life. And it's somewhat problematic because I answer my phone all the time. But patients get my cell phone number. I say, hey, if you have any issues, just reach out to me directly. It's just who I am and the way I've always been. And it's kind of the way I don't have a facade over me. I'm very, very direct, which is to a fault again, sometimes almost too direct, but it's just my personality from the moment I was born, I guess you can say, or the moment I started being, social. That's just what I do. So
I just wondered because I find, and this is a total generalization, but I find that a lot of dentists are in this profession because they are conflict avoiders. and it seems like you kind of like you attack conflict head on, which talking about treatment and talking about money are both very conflict driven conversations. So sorry to interrupt you. I just was like, I wonder if this is something he learned or is his personality.
But I will tell you that I have taken a lot of classes to become a better person, a better business owner, a better leader. I'm all self-taught from marketing. I teach marketing to dentists, but I'm self-taught. But I had to learn to become a better listener. I was a terrible listener. I had one of my first coaches came in the office probably about a year after I bought the practice, and I bought the practice under a premise that the dentist had committed suicide. So I bought a very odd practice, and the patients didn't know who I was. And the doctor wasn't there to transition. And I would speak to a patient and I would talk over them, or I wouldn't listen to what they were saying. So I actually took listening classes. I had a listening coach, I guess you could say, and I learned to become a better listener. And the joke is now that I'm an amazing listener, I hear what everybody says, except my wife. I have selective hearing for her. And she doesn't like hearing that, but that's just the way it is when you're married. But no, it's super important to kind of know where your faults are, or recognize, and I take constructive criticism extremely well. And I always say I'm malleable. So if somebody wants me to change the way I do things, I have to learn it. It's a learned behavior. And so I've learned these things a lot of times, but it's still my personality. If I didn't have the personality, I couldn't do it.
Yeah. Great. Thanks. Sorry for that side tangent, but as you were talking about, like, this is so different from most dentists. Okay. So back to setting expectations.
Yeah. So I call them on the phone. I introduce myself. I find out for them what they're coming in for if I don't know already, or I reiterate what they're coming in for. And I ask them if they've had any, I ask key introductory questions to them. When was the last time you saw a dentist? Are you having a problem? What are you looking to do when you come in the office? So I kind of just start the conversation that way and get them talking, and I listen to what they're saying. And I'll give you an example. So I had a patient who made an appointment. Actually, she wanted to make a virtual appointment during COVID. And I was like, virtual appointments, I was never a big fan of, because I hate virtual, CE and stuff. I'm much better live in person. And so she called the office. She said that or I called her back, and she said that she had a tooth fall out of her mouth. And if a tooth falls out, that's a problem.
Yeah.
So she said it literally just fell out of her mouth. I'm like, well, I knew that deep down she had other problems there. I said, well, why don't you come on in? I promise all we're going to do. And she was terrified of the dentist. All we're going to do is look at you. We're not going to do any work. I want to get a feel for what's going on. I promise you we'll be comfortable as can be, but we'll have a conversation about what's going on. But I need you to do a couple of things before you come in. I need you to consider a budget that you want to spend for your mouth. Okay, it's very important. That the reason that patients don't accept treatment is because they don't understand the money part of things. So that's one of the things I touch on first. I always say to patients, I have affordable payment plans for you. I will find a plan that fits within your budget. Okay, but in order to do that, I need you to come in with a budget in mind. Number one, how much you're willing to spend on your teeth, or how much you can spend on your teeth, as well as a lot of times I ask them how their credit is. I just say, I need to know how your credit is. Do you have an idea? And they either come up with, I have no idea, which is bad. I guarantee you it's bad, and they know it's bad, or it's good and they know it's good. And this particular patient said, my credit's great. Okay. And I said, just come in with a budget. She came on in, very scared. You can tell how she was very apprehensive in the chair. She ended up needing her 4 lower front teeth taken out because they were all periodontally involved, which is my expectation. Right. She didn't want to do implants. She needed a 6-unit bridge, and she needed perio treatment, but she didn't have any cavities. And she didn't have any other real major issues. But she said, I have great credit and I can afford like $600 or $700 a month. And treatment was under $10,000. So I got her no interest for 24 months. Boom, in half hour, she accepted treatment. So that conversation basically allowed me, before she came in, to kind of get through a lot of the struggles that people come in the office already with. And we got bypassed that very, very quickly.
Yeah. That's so great. This is setting it up for success.
As I'm listening, Len, I'm curious to know, when do you do this? Is this like an end of day thing, throughout the day thing, first thing in the morning? Like, when do you find time to actually call all these patients?
So I'm very fortunate that I've used my time very wisely. I know when I have time to do things and when I don't have time to do things. Mm-hmm. And so I find time during the day to do these things. I'm very fortunate in the office. I have an amazing dental assistant who's an expanded function dental assistant. And so when let's say I have a crown schedule and it's 2 hours or an hour and a half in the schedule, I'm literally numbing them, prepping them. She's putting the buildup in, I'm re-prepping them, and then I'm done. I don't do anything else. So in an hour and a half, I may be in the room for 20 to 25 minutes and I'm not there anymore. So I do have time built into my schedule to do these things, whether it's make a call for a bird eye, whether it's to speak to a patient, I call insurance companies myself sometimes because I know I can get things done. So a little bit better than the person at the front desk sometimes. So I have time built into my schedule to do these things. And it's a big important why my practice was really successful. And it's why my practice was not the ideal candidate for a DSO or someone who didn't want to emulate me or be like me to buy my practice.
Yeah. So you're saying you actually block out time to do these things in your schedule. Yeah.
Yeah, well, I know I have blocks in my schedule because of the time we have for appointments. I know I'm not going to be in the room, all the time.
Right.
If I'm doing a denture and I'm doing a try-in or a bite or something, it's all me. I don't have an assistant
Right.
doing it. So, but if it's a crown, I know in an hour and a half an appointment, I'm only going to be in there. I probably have an hour of free time surrounding that crown appointment. So I just do it when I have time, and it impresses the hell out of the patients. So,
Yeah.
one of the other things I do, and I still do, and this is only when I have time, it's a little bit harder, and this was very popular in the beginning when I was building my practice, was I don't do any surgery. I'm literally a restorative dentist, and I've always been. I never enjoyed surgery. I stopped doing endo about 5 years ago. So I am a restorative dentist. I do cosmetics, I do fillings, I do dentures, I do implant restorations, I do some Invisalign. So what I would do is, if I needed to go to an oral surgeon for a consult, I would go with the patient. I would find time in my schedule, go with the patient for the consultation to help have the 3 doctors in one room. I would be there for their surgeries. I would be there when they had their teeth taken out, so they didn't have to come back to my office. I basically had my own desk in the oral surgeon's office because I was there so often. But it was a great practice builder. That's what people said. Dr. Tau actually came with me to the appointment. I mean, nobody does that. So
I've never heard of anybody doing that before.
yeah, it was just I knew I needed to be different because there's so many dentists out there, and if I'm not different, I'm just ordinary, and I needed to be extraordinary, and that's what I decided very early on in my career.
Yeah. Well, and you take like empathy and caring for your patients to a whole nother level. I mean, yeah, for real. That's really great. So we kind of pride ourselves on this podcast of kind of being actionable. And so if there's like, if a practice or a doctor listening is like, okay, I want to start setting expectations for a new patient today, what advice would you give? And you might have already touched on it, but just to kind of sum it up.
Yeah, well, I know that dentists are not necessarily going to be like Len, like me, be like Mike, be like Len. So they're not going to do that. It's a struggle for me sometimes, even when I do consulting with practices, to get them to emulate everything I do, because if you're not comfortable, you're not comfortable. But someone in the office has to take the time to do that. You need to have that discussion with the patients, preferably before they even come in the office. Like I said, so call them, go to a quiet area in the office. Don't do it at the busy front desk, and say, this is an important part of the new patient experience, is wowing them before they come in, explaining to them what they are to expect when they come in, giving them a tour of the office, taking time to make the patients feel welcome to the practice. If you make them feel not welcome, they're not going to accept treatment. And that's, case acceptance is really low, and the cost of patient acquisition is really, really high. So you have to do your best to do anything in your power to make the patient feel like they're the most special person that comes in that office.
Yeah. Yeah. And dental anxiety alone, I mean, that could help so much with just a lot of times. Most of the dental anxiety is wrapped around like the unknown of like who the person is, or what they need, how much money things are going to cost. I call it disarming the patient. You have to disarm the patient while they're in the chair, because they're not disarmed. Anything you tell them, they're not going to accept. They have they're so stressed, they're so anxious. So this disarming the patient even before they come in is so helpful to getting them to say yes to treatment. And whether it's the barriers are financial, and look, if someone has bad credits, you can't overcome that barrier. If someone is concerned about pain, you can show them reviews or stories about how painless your needle is. I actually give a painless needle, and I tell patients that, and they look at me like, no, you're not possible. I'm like, no, I have a painless technique. And people talk about it because it's something I learned very early in dentistry, in dental school, that they said, if you can give a painless needle, patients will flock to your practice. And I heard that. I said, I need to figure out how to give a painless needle. And I have. I've worked on it for years, and my needle is literally painless. You do not feel it. And that again, it sets the expectations that a patient is going to have a really good experience. And you can provide that, patients will flock to your office. It's happened many, many times in my career. Yeah, really great. So advice is to just make time out to at least call the new patients ahead of time and kind of disarm them and kind of break down the barriers.
And if the dentist doesn't feel comfortable, have one of the team members do it. Find the best team member you have on the phone. It's all about voice. It's all about discussion with them. You know, they don't have to be the best in the technical part of things or know everything about the procedures. That's not what this is about. You just want to get the patient talking, get the information you need, get them relaxed to come in the office, and it will change the way that you get case acceptance.
Yeah, I can see that going a really long way.
Now, Len, you're the review king. And with the review king on, we've got to talk about reviews a little bit here. So in the context of case acceptance, I think there's no doubt that before an appointment, when a patient is looking at a Google listing, that's probably going to have some influence on whether they're going to say yes to treatment or not, the reviews they see about your practice. So do you mind talking about some advice to dentists on how they can improve their Google reviews? If they don't have any, how do they start getting them? And talk to the effect that Google reviews have on the practice, on new patients, and case acceptance for a little bit.
Well, it's interesting because the practices that put a value on the marketing they do and actually focus on Google reviews, I think have also greater case acceptance, because the patients are coming in with sometimes a predetermined evaluation of what other people are saying about the practice. And these reviews are like grading you. You're like getting a report card, and they're being spread out to everybody who's potentially looking at the practice. So online reviews, I had so many patients come in my office that chose my practice because of what the online review said. They said, you're my dental care provider. I'm choosing you because of what other patients said. And the latest study that came out in 2021, it's actually a January 2022 release, was that 50%, 49% more accurately, believe that online reviews they trust reviews as much as personal recommendations. So I call that a word of mouth referral versus a word of mouse referral. They're equal basically. And that's pretty crazy if you think about that. Yeah. So online reviews will drive a lot of patients to one's practice without a doubt. I like different stories in my reviews, different levels. Like I don't want every review to be about a filling. I want them to talk about the person at the front. I want them to talk about the hygienist, how great she is. I want them to talk about, the money factor, how we handled the money issue. So I'm very big into, I use an automated system. Obviously I'll be a little biased here. I use Bird Eye because I run their dental division, but there's a lot of systems out there that will do something similar. But the point is patients should be discussed in the office with the patient by a team member, saying, thanks for coming in today. We hope you had a great experience. Just so you know, you may be getting a message after the appointments via text or email asking for feedback about your experience. And we look forward to reading what you have to say. So it's all about the feedback that they're going to give you. Yes, it's a review, but you also have the patient have the opportunity to reach back out to the office and say, hey, I felt too pushed, or I felt uncomfortable, or the doctor I don't trust what the doctor said. And that doesn't go to Google, that's internal feedback. And then you take the feedback and become a better practitioner. So, to me, it's using an automated system and just having the team discuss it with the patients, letting them know, and that's going to give the best results by far with a system like that in place.
I love that you set up the expectation before they leave the practice. You're going to get a review, or you're going to get a link. We want your feedback. And also we look forward to what you have to say. That means like,
you're going to read it.
You're going to look for it, and we're going to read what you have to say. I love that, because so many practices just send the link and hope for the best.
And they don't do anything. And just sending a link does absolutely nothing. In fact, you may get a review, but there's going to be nothing written. It's going to be 5 stars and nothing. And for those people out there, that does absolutely nothing for you. That has no help at all. You want there to be a story behind that review. So you can coach the patient, hey, I know you loved our painless needle. You may be getting a review request. I would love for you to talk about how painless the needle was, because I know that was one of the best features of our appointment today. So almost have a recap of the patient and just ask them that this is the final step upon the recap. And most are happy, willing, and able to do it. They just need to be, pushed or prodded. If you're asking patients without sending them anything, you're going to get no results.
Yeah.
I mean, that's what it comes down to.
Yeah, really. I've never, as a hygienist, I never have done that. So
Well,
I'm
well,
going to do that. Yeah.
I mean, a lot of it has to do with the doctor has to be the leader, and the doctor. I set up a reputation culture in my practice very early that, hey guys, this is how we're going to generate business. The best marketing I've ever done is what I call reputation marketing. My reputation has led more patients to my practice. I think after the last 10 years or 12 years, it was over 1,500 patients came in that mentioned they came in because of my online reviews, because I was a very early adopter.
Yeah.
But that, you can just imagine how much money I brought in simply from marketing my reputation.
Well,
And
and and my practice has over 1,000 reviews, but like, I've never sat down and like, I've never like said, hey, like, I know this went really well. Would you mind talking about this in the review? Like, I have no problem saying that. It just never crossed my mind. So hopefully that was a light bulb for somebody else, because it was for me.
Well, it's just like the same thing that, some people are not comfortable asking for a review,
Right.
asking for feedback's a much better conversation. On the same note, some people at the front are not comfortable asking for money. They shouldn't even, they're scared to ask patients for money, and the patients walk out without paying.
Yeah.
So you got to find your lane and stick with your lane and what you're comfortable with.
Right. Yeah. Well, it's been a quick 30 minutes almost. And we have one question that we asked, and we asked to every single one of our guests. And it's because growth means a lot to us here at Dental Intel, and it means something different to everybody. So what does growth in dentistry mean to Dr. Len Tau?
So in my opinion, growth in dentistry is a practice that improves every day, a practice every single day. You have a huddle every single day. I will give credit to the new owner of my practice, Dr. Christine Hahn. I'll give her a shout out here. When she sets up the huddle, she says, and she's not in the practice full time yet. She just had her third child a couple weeks ago. So I'm covering her maternity over the next couple weeks. But when she does her huddle, she says she wants a brownie and a frownie. So she wants to know the good and the bad of what happened the day before. And I think that's a really great way to improve a practice, because when you talk about your frownies, which are the bad things, hopefully you can eliminate them and do it better the next time. So growth in dentistry is recognizing where your faults are, getting coached on how to become a better person or a leader, and then taking that information and growing your practice to the best level you can.
Yeah. Awesome. I'm
Just writing down brownie and frowny on the piece of paper.
I am, guys. I am writing brownie and frowny. I do this thing with my kids at the end of the day where I say best part, worst part, but I think I'm going to switch it to brownie and frowny.
It's way more fun.
I thought that was, and I don't know if it's hers. I never asked her if she came up with that, but I thought it was terrific. And
if it's yours and you're listening to the podcast, give us a shout out. I'll give you the credit. That's really awesome.
I thought she did. And I think that's really important. It's just growing your business, but learning how to become a better leader and business person. And
just
when you do that, I think the patients just come.
Just day by day, just taking it a day at a time. Yeah, I love that. Well, this has been Growth in Dentistry, a dental intelligence podcast. Special thanks to Dr. Len Tau for joining us today. Where can they find you if they would like to?
So they can go to my website, which is Dr. Len Tau, DRLENTAU.com. All my information's on there. They can also, and you may think I'm nuts, but I give it my cell phone because people call me all the time. It's 215-292-2100. And that's my cell phone number. And they can email me at Len at drlentau.com. And as I said, I will be extremely responsive, almost to a fault sometimes. So you have a question, reach out. I'm happy to help.
Yeah. Well, way to go. Way to give your cell phone out on a recorded line here. That's awesome. Well, we'll have that information in our show notes and other great information by visiting our webpage at dentalintel.com as well. Thank you to Steve for joining me today. And thank you to our marketing department for all their work on this podcast. I'm Katie Poulsen. Keep growing.